Just want to thank you all for joining us for our quarterly ACEs Learning Collaborative today. You're here because you recognize that every child is filled with remarkable promise, and we have a collective responsibility to prevent violence or other forms of adversity from dampening children's potential to learn, grow, and contribute to their communities. But just as a vehicle can only bear so much weight before it stops moving forward, challenging life circumstances can overburden parents, making it hard for them to provide the best kinds of care and support to their children. To prevent this breakdown in care, we must shore up efforts that keep the heaviest loads from weighing families down. A study in the Journal of the American Medical Association examined more than 1 billion US tax records from 1999 through 2014. Researchers found that higher incomes were linked with longer life. Evidence also shows that solid economic supports for families promote safe, stable, nurturing relationships and environments for children. The Centers for Disease Control and Prevention has identified state and federal earned income tax credits, or EITCs, as one of 14 key evidence-based interventions that can improve health in 5 years or less and have been shown to be cost-effective with many direct and indirect health and safety benefits across the lifespan. Today, you will learn about this important tax credit, its relationship to ACE prevention, and efforts across the state to encourage eligible families to file their taxes and claim their federal EITC benefit. Every policy we set, from tax credits to paid leave, should reduce financial pressures on families and increase the time and capacity for supportive family relationships. This approach will not just prevent child abuse and neglect, it will promote greater well-being for children, families, and the communities they live, work, and play in. The Utah Coalition for Protecting Childhood and the Utah Department of Health are pleased to introduce Lori Kellowski Jones, Professor and Chair of the Department of Family and Consumer Studies at University of Utah, and Greg Mcdonald, Director of the Utah Volunteer Income Tax Assistance Program, who will tell us more about the University of Utah's innovative Connect to Collect program, the Utah VITA program, new legislative efforts to improve child well-being through economic policy, and how you can help increase awareness and uptake of the federal EITC across the state. At the end of the presentation, we will have some time for questions and answers. We will be monitoring the chat, so please utilize it throughout, or feel free to unmute at the end to interact with panelists. This presentation is being recorded and will be sent out to all registered participants following the event. And now we'll turn the time over to Professor Kellowski Jones.
Oh, it's like the first time I've ever used Zoom every day. So thank you so much for having me in this context and in this space. As Joey said, I'm Lori Kellowski Jones, and I am Professor and Chair of Family Consumer Studies, which is in the College of Social and Behavioral Sciences. I am a sociologist by training, but also a diehard public policy scholar and aficionado. So I want to tell you a little bit about what we're doing in this project. And I haven't timed myself, but I think I have a little bit of time, but I'm going to kind of keep looking at the time so I don't monopolize all of our time, because I'd love to get to questions. But you know, the purpose of this, and let me just affirm that you still see the big screen, because I opened up an application since I shared the screen.
Yes, we do, Lori. Perfect.
Okay. So when I was thinking about this presentation, you know, and this is a group that cares a whole lot about, you know, the implications for ACEs. But I wanted to remind myself that, you know, when we think about ACEs, we're thinking about a traumatic experience or an event that's happening before age 17, and that is linked to shortfalls in educational and occupational attainment and potential increases in health problems. And so I found a report, I did some digging, that 1 in 6 adults experience 4 or more ACEs in their childhood, and that this number is disproportionately higher for women and those in non-white racial ethnic groups. And so when you think about some of the risk factors for ACEs, parental stress, poverty, substance abuse, community violence, and intimate partner violence are certainly not an exhaustive list, but it's among kind of some of the most important things. And then when you think about protective factors, of course, we think about supportive family environments, parental education, and most importantly for today's focus, household financial security. And this is where I come in. I want to talk to you a little bit about one really important social program that affects financial security is the Earned Income Tax Credit. So and this is a great crowd, and I'm sure I am not giving you breaking news, but I want to tell you a little bit about the EITC, because the EITC is quite simply one of America's best ideas to propel families away from poverty and towards the middle class. It has this unique place because it has bipartisan support, because on the one hand, it is a social safety net program, but on the other hand, it only works if a person works. And this is how it works. A person makes $1 and the federal government matches a proportion of that to a certain certain financial level, and then it starts to phase out. But this has been such an important program over the years for drastically reducing child poverty. Some states choose to supplement it with a state-supported EITC, where they pick a percentage of what the federal government does, and then they kick that in because lots of states recognize that money that is generated locally is spent locally. Utah at this point is not a state that does that. But when you think about the federal impact of the EITC, it's just been tremendous. So what is the issue? If this is such a wonderful program, what's going on in terms of why isn't everybody getting it? And so the issue is that nationally there is about a 20% non-participation rate, which means about 5.8 million households are eligible for this credit, but they're not getting it. And this means that $7.3 billion is not getting distributed from the federal government. In the state of Utah, the issue is actually worse. It's a 25% non-participation rate. And what this means that this translates to about 57,000 households, of which 30,000 households are families with children. And what's happening is $66.4 million is not coming from the federal government into the state of Utah and not getting into household family budgets of families that could really use it. So this is something that has motivated our work with our program we call Connect to Collect. And that's what I'd like to tell you a little bit about today. So if you think about this 25% of households who are not getting the EITC, but they're eligible, I want to tell you a couple of things about that. One thing that's interesting is that there's a lot of churn. And this is to say that because of changing family circumstances and economic circumstances, that there's about a third of this 25% that changes each year. So there are different folks that find themselves newly eligible for the EITC. And in the context of the COVID reality that we find ourselves, there's even more churn. And when I pass it off to Greg, he'll talk about some of the things that have been happening more recently and kind of putting it into like a just-in-time context. But if you think about this 25% of households who do not get the EITC, I like to think about a family, and it makes it come alive for me. So imagine a woman, Maria. She has 2 kids. She works 2 jobs, and her 2 jobs get net a salary of $30,000. So for Maria, having an annual household income of $30,000 and the number of dependents that she has, that would entitle her to an EITC benefit of $3,500 or $3,512. But the other thing that's interesting about the EITC and tax credits in general, the EITC is not the only one. If you have children, you are eligible for the child tax credit. So for her 2 kids, she would be eligible for a child tax credit of $2,800. So this would take her income from $30,000 to $36,300. And so this is a 21% income increase. And think about what a person could do with that. If you annualize that over a monthly basis, it's about $500 a month. That can be used for all the things you just can't afford, like glasses or better health care, better child care, a variety of things that are really important to families and really important to increasing family financial security, which has been shown to be a positive protective factor towards preventing adverse child experiences. So if this is such a great deal, how come she's not getting it? So I like to tell people, well, let's take it back to Maria. She's working those 2 jobs, right? And so she's probably pretty busy, maybe too busy to seek out tax credits such as the EITC. And people like Maria, a lot of people, not just Maria, may have a less than positive perception about what the federal government could actually do for them. So what we want to do in this program, what we are trying to do in this program, is to increase awareness about the positive benefit of the EITC by providing education about how to get it, and access points where busy families already go with people that they can trust. And so this is our program. And so what we're trying to do with our program is to expand the tax participation in tax credits by finding avenues for free tax preparation. And what we're trying to do is to identify and capture eligible EITC households. And then we want to extend avenues for people to claim their benefits. So when you think about kind of access points, people are busy, but where do even the most busy families with children go? They take their kids to the doctor, they take their kids to school, they take them to places of worship. And overall, they trust the people that they interact with there to have their best interests at heart. So we want to leverage these trusted places, and we want to involve a network of student volunteers and these trusted partners. And we're also using some technology to provide free tax help at VITA sites. So here I got to back up and tell you a little bit about VITA. Many of you probably already know, but the Volunteer Income Tax Assistance Program is fabulous. It's been around for a while. But one of the issues is that with families who are eligible for the EITC, they might be tempted by other tax preparers that historically are not as well trained as EIT or as VITA volunteers. VITA volunteers, to become a VITA volunteer, you have to be certified by the IRS. A lot of other tax preparers that you see kind of, in various places in the community, maybe they don't have to have that certification. So what we want to do is to encourage folks to go to VITA as opposed to some of these for-profit tax preparers that can take a big chunk of return. And so we are doing this because it'll increase family income in the short term, but there's going to be improved wealth and health across the lifespan. So this is kind of the crux of what we're trying to do in a big picture way. One of the things that is a feature of our program is that we're starting small. We have some partners here in Salt Lake Valley, but we want to expand our reach. And we do realize that 80% of the state's population lives in about 4 counties. So in this first year, we are working with our established partners, and I'm going to tell you about them in a minute, but we want to use data science to expand our efforts into the state of Utah. So that's why I'm very, very excited to be on this call with such a diverse set of folks that are on this call that represent a lot of different places in Utah, because we're always looking for partners. And we want to use data science, which is this idea of hotspotting. And what is hotspotting? Hotspotting is using data to find places with characteristics that you care about. And in our case, we care about places where the EITC, there is a high level of EITC eligibility and perhaps a lower pickup of using the filing taxes and getting this EITC benefit. And so what I've shown here is we've just mapped this with health sites. and I'll tell you about the health sites in a minute, but these green dots are the health sites that we have identified in this first period, but we've identified other health sites throughout the state that potentially we could focus on. And then also we are working with schools and some other trusted entities. So what we're doing is we're using technology. And so we're using this hotspotting data technology, or it's data science to kind of find data, get the data to help you to figure out kind of where your efforts are going to be the most successful. But then we are working with trusted health professionals to inform clients about the benefits of tax filing. We're using some smart technology that we've developed through RedCap, which is a survey client that can tell you, we're arming our volunteers with the ability to use this survey, which is so easy. You can kind of sit down with a client and say, hey, it looks like you are eligible. Here's how much you are likely to get. Here's where you need to go to get the credits, and we'll help you sign up. And then we're going to follow up with you with text reminders to tell you when and where and what to bring. And so the net result of this is that taxes are prepared and filed and credits are generated. One of the things that is really important to know about the EITC is that there's just so much evidence over the years about the really durable link between receipt of the EITC and just a host of really positive health outcomes, starting with the parent, and then across the lifespan. So when you think about this, parents, can enjoy immediately higher household income, but it's been linked to increased employment and improved maternal health over time. One thing that has, that's important to bring up too is the link between the EITC receipt and infant health outcomes. There has been a very durable connection between getting the EITC and having better birth outcomes in terms of birth weight and not having preterm outcomes. I was surprised when I first got into this research how expensive preterm births are. An average preterm birth can represent as much as $30,000 in healthcare spending. So if you could just reduce that by 10, 20 events, just think of like how much money could be saved. But also the EITC has been linked with better outcomes in childhood in terms of improved school performance. Among adolescents, you see more formal higher education attainment going to college, and then across adulthood, higher income. Another really cool thing about the EITC is the potential for spillover effects. And what are spillover effects? That means that when federal dollars come into an economy, they not only help the person who's getting the EITC, but it also has a spillover effect into the local economic environment. And they talk about it as a multiplier effect. And it's as much as 1.7, meaning that like $1 comes in, it makes that dollar plus $7, $1.7 more. And so this can be really significant for local economies. So we're really excited about the potential for just, edging away at this lack of receipt of the EITC among some populations that are eligible to have not only really important individual benefits, but then to have important health benefits as well. And then also to have health benefits, both in terms of the individual, but also cost savings in terms of health spending, as well as these kind of community spillover effects. So I wanted to tell you a little bit, I've been talking about these medical partners. So when we first got started with this, we started with, it all started with a TED Talk. I love TED Talks, and I listened to this TED Talk about this clinic in Boston, and the person who was the pediatrician, she started asking her patients, a lot of them were low income, like, how's it going with your finances? Which was kind of an uncommon thing for a pediatrician to ask. But, as she got talking with these clients, they said, what would really be cool is if you could do my taxes while I wait in this waiting room. And she was like, oh, well, I'm not necessarily, it's like Star Trek, darn it, Jim, I am a pediatrician, not a tax preparer. But then she got to thinking about it. She was like, well, why not? Why couldn't we do that? And so she started this thing called Street Cred, where they have pop-up tax clinics in hospital waiting rooms and of this clinic in Boston. So I saw that idea and I thought, you know, I talked with some friends, and these are my friends that I and my team. How could we do that here? And so we first started, and first I gotta let you know who my team is. I'm working with Norm Weitzman, who is the chair of economics at the University of Utah. Dr. Michael McGill, who is a family practice doc and a longtime head of family and preventative medicine. Dr. Kathleen Zick, who is a consumer economist, who's one of my department colleagues. Ann House, who runs the Financial Wellness Center here on campus. Greg Mcdonald, who you're going to hear from, is on our team as well. So I'm not going to steal his thunder, but he is fabulous. And then we are so fortunate to have Vidi Najira, who is our project manager. And so how this started is that we made a connection with Connect to Health, which is a student organization that it's kind of like AmeriCorps in college. You sign up and you say, I'm going to give you this many semesters and I'm going to give you this many hours a week. And they place these students in health clinics for the University of Utah. And so as they're waiting for their appointment, they're counseling them on social determinants of health, you know, broadly speaking, you know, what are the things that you need and trying to connect them to services. And so they are now one of the groups that's leading you know, these clients potentially, if they affirm that they are interested in learning about taxes through our REDCap tool. We're also working with United Way with their 211 call center. So if people call and they're not calling about taxes, 211 staff leads them through our survey. We're also working with some school entities. We're just starting out, but we have a relationship with Granite School District, and we're working with their Office of Educational Equity to kind of reach out to parents. And we hope to make some more connections. And a very key partner, of course, is VITA. And then also I meant to say, we are also working with with AHEC, which is Area Health Education Centers. And this is such a cool program, and just, you know, something that I didn't know about until I got into this research and this kind of program. The AHEC has offices all over the country, and they work with students, they work with community health workers. And so we are working with some community health workers and they're doing reach out to their clients and the people that they interact with in the spaces that they interact with them, and leveraging that trust that they have with families to tell them about the EITC. So this is our project that we have going. And we're really excited about it. And, you know, just as a side note, I've been a professor for a long time, and this is the first project that I'm actually going to help people. And I feel like, you know, I was just speaking to a job candidate that I've done a lot of research that I think is helpful, but there's something about hearing from our student volunteers that are working on our project, and from Vidi, our project manager, and Greg and Anne, talking about how they talk to families and they realize that they can have this resource that's just going to dramatically change their economic landscape, and how it is just so gratifying, and just really excited to be part of that process. But this is a multi-year project, and we're in kind of the early stages. So I love telling the story and kind of making these connections and making new friends who might be interested in partnering. I think that's my last slide. It is. And I'll turn the time over to Greg, because Greg is the expert on how things are changing, and just, you know, he is the state director of VITA, and I'll introduce him now. And I'll stop sharing as soon as I figure out where that is on my screen.
Lori, I actually took over the screen, and so.
Oh, good. I was like, wait a second, I don't see how. Okay, perfect.
You should be able to see Greg's document here now. And Greg, just go ahead and tell me when to scroll down if I'm not scrolling down or whatnot.
You're on mute, Greg.
I'm having a problem because I'm on mute. I'm having a problem with Zoom because I can't see the shared screens.
I can't
So
see
can
it.
you allow me to share the screen so I can see it?
Absolutely, Greg. If you've got it and can go ahead and share, take it away.
Okay. I am tired of Zoom, but I came up
Aren't
with
we all?
a new name for us. Instead of zombies, we're zombies. I'm sure that's come up somewhere else, but I'm just going Zoom. So Zoom has crashed on me where when I initially open it, I just see pictures of me and nobody else. And then when somebody shares, I sit here and I have Lori's presentation. So I was scrolling down here, following her.
Greg,
I
we're not actually seeing your slides. You're sharing. There you go. Perfect. You got it.
got it.
Oh, it bounced back. There you go. Oh,
Yeah, I know.
there we go. You got it. Excellent. Thank you.
So my name is Greg Mcdonald. I've been with the VITA program for almost 20 years, volunteer for many, many, many years, and then the regional coordinator for Salt Lake. There's 9 regions. We do 20,000 returns a year. It's a great program. Once I get you as a volunteer, I get to keep you. And the reason for that is very few programs are direct help. And hopefully people that are on this call are people that have folks that are actually first line helpers, have that feeling that you're getting thanked for your help because you're helping people. So became the statewide organization, or head of the statewide organization a couple of years ago. He said we have 9 regions. We cover every area of Utah, and we're not going to do 20,000 returns because of COVID. We usually have 68 sites open. We're down to less than half of that. We have some in-person sites down in southern Utah, but most sites don't want to be open yet. And a lot of volunteers don't want to be out in public, even though that's slowly changing as people get vaccinated. So it is a free service, 100% free. And I'll just put in an extra plug for us, because when I say free, a lot of free tax programs might charge you for certain forms. A lot of free tax services will charge you for a state return. And you see you're getting a refund. You've done all this work, you're getting a refund. So you go, oh, I'll just click on that button that says yes and pay $25 for my state return. But this is 100% free, and something we're offering because of COVID. I was going to say because of VITA, because of COVID, is we have a virtual process. If you go to Tax Help Utah, you can find the sites that are open, how they're operating, a lot of what we call drop-off sites, a virtual site that we're doing. We're getting people from all over the state. We're doing the virtual site in Salt Lake. We're just starting it this year, so we're doing it on a smaller scale. Pluses and minuses with that, but we're plugging along. And lucky us, we have till May 17th now. We got an extra month, which I hope everyone, we VITA people kind of expected. And what I didn't want to see was July, like last year. And then when the freeze happened in the South, Texas, Oklahoma, and Mississippi got till June 15th. So I was thinking maybe it would be June 15th. So the volunteers are all signing up. It's great. We'll just keep going in most sites through May 17th. So EITC, I want to cover today the changes that we just had in the tax law, but EITC, when Lori mentioned that we're 25%, I just want to mention that I'm excited being part of this group. It is good to get, I guess I get a lot of response when I talk about some of these numbers. And then it's like, what do we do? And it is tough. And I've always felt that Tax Help Utah has done everything over the years. Maybe we just need to do more of it. But when we say we're at 25% missing, that means 60,000 people in Utah who are eligible for EITC are not collecting it. And I didn't put a number there because it's tough to estimate, but our average EITC is $2,115. So if we say half of that, let's say it's mainly singles who are missing, we can bring that down. And now that the EITC for singles has gone up, I guess we can feel pretty confident that's probably $1,000 a person that we're missing on EITC. Now, on top of that, the economic impact payment, last October, the IRS said we're missing 70,000 people. We had a last rush to have folks come in and register. We were at the library. We were putting out, nonprofits were putting out flyers. We're just trying to get outreach for folks. So 70,000. and you look at those EIP numbers. So I don't know how much of a dent we made. They never gave us a final number, but each individual that did not get EIP is missing 1,200. They're an adult, 1,200 for the first round, 600 for the second round, and then the one that just got passed is 1,400. $3,200 times 70,000 people are missing $250 million in the state. So just those two statements, we're missing a lot of people who don't think they're or aren't aware of these benefits. Okay, so we're going to cover today the American Rescue Plan Act signed 2 weeks ago. We have an economic impact payment. We have unemployment compensation, forgiveness of the advanced premium tax credit penalty, earned income tax credit for single filers, child tax credit's the biggie. And then something I'm not going to cover, but daycare credit has gotten better. It used to be 20 or 25% of the credit could be applied to any taxes owed, and now it's 50%. So economic impact payment, we had the first round, $1,200 for each adult, $600 for dependent children. To receive the payment, the Treasury Department has to have you on file, has to be a tax return on one of the Social Security benefits or a veteran benefit. And if you're not part of the list above, you could file a non-filer form to collect. Now, I just want to, I'll say this later also, but just want to point out that when something like a program like this comes on us or comes to us, it falls on the IRS to go make it work. And the non-filer form was a mishmash. I don't know if like they had 10 people working on it, put it all together. But the fact is it just fell on them, okay? So everything else when they get a program like this kind of slows down. So I had a friend who did a paper return, filed it in February, finally got his refund in September. The IRS started accepting returns this on February 12th. They usually start accepting the last week of January because they got the second round that came in. So it's the same group of people. We have all been in the situation where you're doing your job, a crisis happens, so you have to do your job and the crisis. So I got to give a lot of credit. They've made it a little bit easier, but the point is we still have to get people to be recognized in the Treasury Department system. And now, so it's just through a tax return, okay? So the second round came out right after Christmas, and it was essentially late December to January 15th, though checks were being sent out in February. That one was $600 a person, adult or child. And it's based on the first round stimulus payment. So they came in and said, we've given this money out the first round. Hey, this is easy, just go do the second round. So they just copied what they did the first round. So we're still missing all these people. The third, the tax return is very simple to do for people to recover. So they don't necessarily have to visit a VITA site. On Tax Help Utah, there's a DIY, do-it-yourself option. You can go to DIY. It's TaxSlayer software, which is what we use in our VITA sites. And it asks you for a little bit of personal details, i.e. what's your email. You submit it, 45 minutes later, you'll get a response saying, here's your code to get in. When you file for this rebate, you're putting in your name, your address, your social, your birthday, who's on the return, and then it takes you to the income page, and on the income page, there's 5 things, and the 5th one is recovery rebate. You fill it out and you're done. Well, you have to submit it and you're done. So it probably takes 5 minutes. I know if people aren't used to doing their tax return, it does not take 5 minutes. If you were not on the list in the first round, you can enroll by filing a tax return in the second round. That's what we're doing right now. And it allowed families, the big change, families with one parent having an ITIN to collect for family members with Social Securities. Channel 4 here had a great, and I thought it would get a lot more play. It interviewed a family. He had an ITIN. That means he does not have a Social Security number. He's here. He has a card. Mom had a social. The 3 daughters had a social. They both worked in restaurants. They both lost their jobs. They were not eligible for that first round. The second round made the people with Social Security numbers eligible. So something that I personally thought was unfair in the first round got fixed in the second, and is fixed in the third. The third round, $1,400 per person. That changes there, includes all dependents, not just those under 17. So child tax credit is set up to be for kids under 17. This is kind of under 18. We reconcile everything through the tax return. A child born in 2020 will receive all 3 rounds of EIP. Any dependent listed on the 2020 return, including parents and those over 17, will get this $1,400. So they want to send it out as quick as possible, but when they see a tax return, the IRS will adjust. So good news all around. We got to get these people to file a tax return. Unemployment compensation. The state of Utah, as of last Friday, also extended their state tax filing date to the 17th. There's no announcement on unemployment, but the Fed unemployment, the first $10,200 goes tax-free. The minimum savings there for a filer will be $1,020. That's 10% of the $10,200. If you have not filed your taxes yet, the correction is on all the software. In other words, going forward, this is as of yesterday, and this is how fast these changes are coming. And going forward, it automatically takes out the first $10,200. If you have filed your taxes, we're waiting on direction. This morning, the direction came in. The IRS will correct the returns already sent in, so we don't need to do amended returns. So everybody that got sent in, if they've already gotten a refund, will get a second deposit or check. If the refund is in process, the return's in process, the refund, they will get a higher refund than what we told them. 15% of the people we have done this year at Tax Help Utah are impacted by this savings. The waiver of the advanced premium tax credit penalty. I'm sure that many of your groups have dealt with this. If you're on ACA, Obamacare, government healthcare, whatever you want to call it. This is unfair. I use the word miscalculated. It's not. So the way our insurance works, ACA, is you come in, you predict your income. Here's your family size, and the government's going to subsidize you. And of course, you're making money, I guess, low enough income to qualify for this benefit. So the boss comes in and says, you want to work overtime, you want to cover for a couple people, you're going to say yes. The program says that you're supposed to call and say, I've gotten an increase in pay for X amount of time. They adjust what they're giving you. Well, all that comes together or gets reconciled at tax time. Okay. And we see some hefty ones. Right before this got signed at one of our sites, we had somebody with a $1,200 penalty. So that waiver is in place for if you have a penalty. So that person had $1,200 meant they made more than they predicted, which is, good on them, but they have to pay because the government said you shouldn't have gotten that much from us. So I expect the IRS to take care of this too. They haven't announced it yet. They just have to zero out on Schedule 3 one line, and they can do that on their end. 12% of our returns will be impacted. And again, that largest amount we've seen is $1,200. And it's tough when they have to pay back the full amount, but anyway, that's taken care of for this year. So earned income tax credit for single filers. This really gets to what this presentation is about, and this is good news. So EITC, earned income tax credit, has not changed for head of household, married folks, and those folks with kids, but it's always been very low as far as you maxing out for income and the amount you get. So we used to have, so think of all the EITC as a mesa. It starts at 0, but the more you make, the more you get. And then there's a huge flat top. And then the more you make, you start zeroing out. So for a family of 5, it zeroes out at 56,000 something. A family of a single mom with 3 might zero out at 52. And so it's all different scales. We just let the computer take care of it, software take care of it. But it was more of a mountain for the single filer. And the height of it was 8,000. So the peak amount you can get, which is 538, is at $8,000 income. And then you get to 15,820, you get $1. So 15,821, you get 0. And it has an age requirement of 25 to 64. And yes, we see a lot of seniors who have very little income from Social Security, no pension. A third of companies provide a pension, or a third of retirees have a pension. So they are working, and they're not working a lot. So they got $8,000 in Social Security and $8,000 working a job, and they're not eligible unless they have kids, the grandkids, they've adopted them. So now the new amount is, it goes up to 1,500. I don't know where the peak is. I haven't seen that data yet. And the income limit is 21,000. That 21,000 used to be the income limit for a married couple with no kids. So I assume down the road, that's going to go up. So we've raised the amount you can get. We've raised the income limit from about 16 to 21,000. The age requirement is not 25 anymore. It's down to 19 if you're not claimed. Okay. And you can't be a student going to college, and there's no longer an upper age limit. We have, I don't know if I have it here. I know 100 out of 42, 472, 22%, I think, of the people we've done so far impacted by this. So the example I use, this is from, a lot of this information data is from the Center on Budget Policy and Priorities, CBPP. I use them for a lot of things as far as their analysis. I've also used HK Law, which has a great summary of the entire tax package. It's the 30,000 foot level, 10,000 foot level, whatever you want to call it. But boy, it affects so much of, let's say, Utah, the nation, of course, but Utah. And it's great. But I use CBPP to get kind of drill down and help me make sure I'm doing this right. So this is just one of their examples. Right now, if we have somebody working 30 hours a week at $9 an hour, which is not unrealistic, their income's $13,007. We have they're right above the poverty line. They have to pay half their payroll tax. Company pays half, they pay half. It's $1,048. Then they're going to end up owing us $130 in taxes. Helping her is $116 EITC. So she ends up $940 below the poverty line. Her new EITC would be $1,016. Now she's $29 above the poverty line. So it saves her a bundle. And at least, I know it's not a lot, but she can be above the poverty line. 17.3 million will be impacted by this change. And that includes 138,000 Utahns, fellow citizens here. So I love this change. To be honest, I never understood why we, getting into my personal stuff, I never understood why we tax unemployment. That's taken care of. And now this EITC might motivate some single filers to file. Okay. So a big change affecting the single folks. This is just a Center on Budget and Policy Priorities. I was looking at their American, they have a few out already, but American Rescue Plan Act includes critical expansions of child tax credit and the ITC. Just came out a week ago, a little over a week ago. Child tax credit, here's a biggie. The credit amount has been increased. If you're under age 6, you go from $2,000 to $3,600. 6 to 17, the amount is increased from $2,000 to $3,000, okay? The scope has expanded. It used to be 16 and younger, now it's 17 and younger. The credit amounts will be made through 2021. I'm saying, yeah, half of the amount will be distributed sometime in the spring, maybe early summer. So if I'm going to get $3,600 for somebody, I'm going to receive direct deposit or a check, debit card of $1,800. And then from July through December, I get $150 a month. If they're in that older group, I'll get $1,500 and they'll get $150 each month, okay? The credit is fully refundable. Now we're into some tax talk. So the $2,000 max before, $600 had to be used for what we call tax liability. Tax liability is essentially, here's my income minus my standard deduction, gives me my taxable income. I go out to the tax table and it says you owe $600, and then it starts looking at the credits. One of the credits that would look at is the child tax credit of, and it'll say, oh, I need that $600. The 1,400 is refundable. That means if I don't have to use it against taxes, I can get 1,400. I can't get that last 600. I got to use it or lose it. Okay. So it has to be used to pay off tax. The 1,400 I can get as part of my refund. So if I don't need it, that benefit's really 1,400. And in a way that affects lower income people, because higher income people probably always have a need for that 600 to pay off some taxes, where the lower income won't. And yet both of us are eligible for the 1,400. Now the full 30,600 can be received as part of a refund. So it's really a $2,200 increase that some of these families are going to receive. It's just great. Now, child tax credit. You had to start earning this at 2,500. So yes, we do returns. People work part-time. They just couldn't, for a very little bit during the year. And they come in with $1,500 income, 2 kids. That's all they got. And they're not getting child tax credit. They're getting some earned income credit. So what I don't know for the child tax credit is how it ramps up. So you'd hit 2,500 and you get some child tax credit. Then you make a little bit more and it ramps up, and then there's one point where you get the full amount. So I haven't seen that yet from IRS or CBPP, anybody, but it's nice. It's going to start from 0. Per the CBPP article, 860,000 children in Utah will benefit from the new law. So families will benefit. What I don't know is this 860,000 people, kids, children, who are already on the Treasury books. They're already in a tax return. They're already on some kind of Social Security benefit. Or does it include another way to get out the 860 that includes every child in Utah? So it could be higher than this 860. I think this is good. So the impact, I want to look at Maria again. So Lori mentions Maria. Maria earned 30,000. She's head of household filer. She gets a standard deduction. Sorry, tax stuff in here. Standard deduction of $18,350. That says she has $11,650 of taxable income. So she owes $1,168. As she receives $3,600 now per child times 2, $7,200 child tax credit. The $1,168 of that is used to pay taxes owed. Maria's family receives $6,032 as part of her refund. Okay. So she hasn't filed before. We're telling her to file. She's been told over the years she doesn't have to file. And the IRS, per the IRS, she doesn't. IRS will never send you a letter saying we owe you money. They will quickly send you a letter, at least within 3 years, saying you owe us. So they see everything she's doing. They see her incomes, her W-2 statements. She doesn't file. They know what's going on in her family, so they're not going to send her. So she hasn't filed. That means they haven't given her round 1, round 2, round 3. So she's missing $8,200 in her EIP. She's getting more for the child tax credit. So her annual income, we had it going from 30K with the old child tax credit and the EITC, and the EITC has not changed for her. She went up to 36.3K. Now she goes up to 47.7K for this calendar year. Okay, none of this is looking forward. All this is for 1 year due to COVID. So how dramatic is that, that if she filed, she would get the 30,000 income that she reports. She would think she would get EITC. She would get child tax credit on her return. She gets this new child tax credit. This new child tax credit will be reconciled next year. Okay, so there, it's like a bonus child tax credit this year. So she gets an increase. Oh, by the way, she also gets the EIP that she hasn't been collecting because nobody knows about her, or at least the federal government doesn't know about her. So that's probably, I always thought when we first came up with this example for Maria, going, wow, that's pretty dramatic. Well, we just made it more dramatic just by getting her to file a tax return. That's it. We can change some lives here. One last thing. One of the things that, when we had the low-income pediatric clinic in Boston present on their TED Talk, and I know that they're doing this in other clinics, About a little bit later, the California Policy Institute came out with a study. They had taken the California State Tax Commission, Target, Blue Cross Blue Shield. They each did something to impact EITC participation. California, a little bit, they're number 50, a little bit worse than Utah at 73% participation. So one of them, State Tax Commission, sent letters to people, said, we think you're eligible for this, please file a tax return. One of them did, let's say, ads on TV, the other one did brochures. Nothing statistically significant changed that performance, that measurement that year. So the conclusion they had was that we need people in positions of trust to reach out to folks. And we know that the health clinic, the doctor, of course, the medical people there are in a position of trust. We also know that religious folks are in a position of trust. We also know that a friend telling someone else is in a position of trust, teachers, schools, and then certain government entities. So when I think of a government entity, it's those caseworkers, those frontline workers who are working with people. I think of organizations that are working with this clientele, just putting the word out, because I come in and I say, hey, I can get you all this stuff, and I do the VITA program and I do it for free. Do you think I have trust? People are like, what? You do this for free? Why? You're crazy. So we get into that conversation. So once they get it done, they're mine forever. But to get them to come in, it comes from those 5 groups. It's not necessarily just the advertising, the PSAs, because a lot of our clients are going, you're not talking to me, that goes right by me. Yes, we are talking to you. So big changes to this. Congress, I know, is looking at that child tax credit and they want to make that permanent. I don't know if the other ones will stay permanent. And it all happens this year if we can get these people enrolled. Thank you.
Thank you so much to both Lori and Greg and their team and the amazing work that they are doing to increase the uptake of this very important anti-poverty tax credit, or these important tax credits. I know that with what Greg presented, my head hurt a little bit.
Yeah, sorry,
I'm a public health person and not a tax person. So we've got just a couple of quick minutes. If there are questions, it looks like we do have one that just came in on the chat, but please, if you have any questions, pop them in the chat real quick and we'll answer them. First question, if the parents aren't here legally, but the children were born here, can they get stimulus payments? What a great question.
If the kids have socials, they can get it.
And I could add to that, and correct me if I'm wrong, Greg. So if you encounter a family who has a mixed status, so let's say, for example, that the parents have ITIN numbers and the children have socials, then in that case, they wouldn't qualify, the parents wouldn't, or that family wouldn't qualify for the EITC, but they would qualify for the child tax credit.
Child tax credit, yes.
And then in regards to the stimulus payment, from my understanding, we have 3 now. The first one, none of them, if there was one person who has an ITIN number, nobody in the family would qualify for the stimulus check. But thankfully, with the second check and the third check, even if there's one parent who has an ITIN number, that person doesn't qualify for it, unfortunately. But the parent, or let's say the mom does have a social and the kids do too, for the third and the second stimulus check, they would be able to qualify for
Yes. So you lose the ITC if a parent has an ITIN. I'm waiting for them to make it retro to the first stimulus, but right now, not. The second and third and child tax credit, you're eligible. The kids have to have socials. Or the
Greg,
one.
I have a question about the child tax credit. Are there efforts to make this a permanent credit?
Yes. The thinking is both politically, once you put something in, you can't take it out. They said of all those changes, they can relate to the penalty on ACA, they can relate to unemployment as a COVID-related issue. They won't push that, but they want to make the child tax credit and the single filer, which has been waiting for a long time to happen. So the single filer EITC and the child tax credit permanent, with the child tax credit being, I hope it catches up to a tax return. So in the year you file, you'll get it, and it will be spread out over the year versus one big amount of money coming out. So yeah, they're pushing for that, but I don't know when that will happen. Sneak it into an infrastructure bill, or who knows?
And another question, if a family hasn't filed at all, can they go back and get all of the stimulus payments? Looks like Viri actually just answered that. So thanks for that, Viri. Chloe has her hand up. Go ahead, Chloe. This will be our final question.
Oh, wow. That's so much pressure for me.
Think it
I
could.
work with a lot of mixed families as far as who is raising the children. Sometimes it's grandparents who haven't legally gotten status yet of their grandchildren. And I'm wondering, a lot of them don't have access to the biological parents. So they claim the children, they file for CTC. If like, for some reason, the biological parents also did that, would they be denied, or would there be like a case opened? Do you know?
Yeah, so what happens is if anybody claims, and we do see this, if somebody claims somebody first, the second person to file their returns rejected, saying that this Social Security was already used, previous tax return. That second person has to go in and do a paper return, just in a quick one pager. We'll do it in a paragraph why that person should claim them. So in those grandparents, it's who supports them, who do they live with? That gives them the right to claim them. I'm supporting you, you're living with me more than half the time. So the IRS will send something back asking for proof. This isn't quick. And then once they send the proof in, if they'll decide whether you get the money. So the grandparents would get the money. They don't wait for it to get, they don't wait to get it back. But then they'll send a letter to that other, the kid who claimed, the adult child, the adult who claimed, and they will say, we want that money back. Let's start talking about this. And they'll never get a refund again. And then if it gets serious and they call it fraud, they'll go after them with fraud, which means you can't get EITC for anywhere from 3 to 11 years.
Okay, perfect. Thank you so much. That's more than helpful.
Thanks for that question, Chloe. I'm a little bit not with it today. This event is actually scheduled until 1:30, so we do have more time for questions. I have a question for Viri and Lori. Lori, you mentioned that you're looking for partners outside of the Wasatch Front. What kinds of partners? Who do you want to partner with? What can this group in this virtual room right now do to promote what you're doing?
Well, first, we want to go statewide, but there's a whole lot of the Wasatch Front that is important too. I would say that, we're trying to partner with people who have trusted interactions with clients. And if you are regularly talking to clients and they trust you, you're just a perfect opportunity to kind of tell them about our program. And, we have the survey that you can access on your phone or on a computer or on a word, on a pad of some sort, and, and take them through the survey. And, we're trying to track, where our referrals are coming from. So like if we became partners, I would like to be able to add it to our Red Cap survey, so you can pull it down and be like, oh gosh, Holly Uphold was talking about her organization. Like we could know that it came from those guys. So in terms of taking them through the survey, that helps them kind of see, where they can go for tax help, because we can tell people about how important this is, and I think Greg is really compelling. He's like, what do you mean this is free? It's a hard thing to say. Yeah, that's actually on the up and up. So it takes, folks who have, ideally kind of, repeated contact with a clientele that might be able to benefit from this, that we would love to set up a partnership and, think about kind of partnering that way, either if it's in the Wasatch Front or, throughout the state.
And just to add on to that, I'm gonna send the flyers to Nathan, and he could go ahead and share them with you all. We would love if you guys could spread the message. especially now that tax season is ending, like in the next few weeks. I think it's a really good opportunity to get the word out. And once again, we are able to do up to the last 3 years. So they didn't file for 17, 18, 19. That's something that we could help with.
Yeah, just to clarify that, we'll be sending out an evaluation survey after the event, and we've included some of the materials that we created for our EITC awareness campaign last year, and as well as some other things that I guess we need to ask Lori and Greg. Can we share your slides with the group
Yes.
as well?
Yeah. Mhm.
All right, those will be included as well.
Fantastic. And to pick up from what Viri and Nathan mentioned, I will kind of jump in there and explain how the Utah Department of Health Violence and Injury Prevention Program has worked over the last year to promote awareness at EITC. The piece we were missing was the boots on the ground piece, and we were able to connect to collect and really want to be able to spread the gospel, for lack of a better word, about the effort that they've engaged in. One of the things that we did before we were connected with Connect to Collect was develop an online awareness campaign. This included some television spots where we did some interviews on lifestyle channels last year. We developed some handouts, informational fact sheets about EITC and VITA, as well as posters in English and Spanish. Now, these flyers and posters were actually printed and ready to be distributed to partners last year when COVID hit and the health department building was shut down. So right now, as we speak, there are stacks and boxes of posters and flyers at the Cannon Health Building that if you want them, you can set a time up with Nathan to meet him down there and pick them up, because he actually goes into the office a few days a week. So these posters, we're actually working with the community-based child abuse prevention coordinator at the Department of the Department of Human Services, Tricia Reynolds, as well as partners, family support centers across the state to distribute these materials during Child Abuse Prevention Month, which is April. We would love to, if Viri, you have a fact sheet that we can include with the stuff that we've prepared. The printed materials are a trifold brochure, two-sided trifold brochure, but in the links that we will mail you after the event, the fact sheet has been brought down to a one-pager so that it's downloadable and printer friendly. So if you want to mass produce those to provide in your waiting areas or in client packets and those types of things, you'll be able to have access to that.
And I think we should point out that research that was pointed out in California, it's not just the materials that are getting people to go. So again, you make sure that your staff and the people that you work with are actually reaching out to those individuals and talking to them about it, because they might see the poster and that might not mean anything. So it's really those interactions about what's going on that are key.
Greg, I have one last question. We've talked about federal earned income tax credit, but we haven't talked about state earned income tax credit. Does Utah have a state EITC? If not, are there plans to institute a state EITC? And do you have any idea what the political momentum or political climate around that policy push within the state looks like?
Yeah, so we came close to it, I guess 2 tax seasons ago. We have, if you remember, we were looking at a big change to our state tax laws. And some legislators were going around the state presenting, and for some reason I guess the pushback was, you guys are just railroading us through, my words. So people petitioned against it and it got stopped. And at that point, there was a small state EITC for a small group of 2 generational families identified through our intergenerational poverty group. So it died. So it's out there for our legislators. I didn't see anything this year on it. And some people there are people who have said that we won't be able to do one until we change our tax laws. We're just spread too thin. The states that are higher in EITC participation, nobody's a superstar. We ranged this past year, I say past year, it's always a couple of years old data, from 73% to about 83%. Indiana wins the award last year. So nobody has figured this out. But the states that are 80 and above all have a state return, because suddenly that becomes something that the states are pushing. So you don't see too many states, except for our friends in California, with a state EITC that have participation below 80. And again, if we went from 75 to 80, that's a big chunk. I'll take 12,000 more people getting EITC. So we were close. I just didn't hear anything about it this year, Joey.
So I actually looked into this a little bit, and yeah, so it did pass as part of that big tax overhaul that happened and passed in a special session at the end of 2019. But then that was, sorry, the EIT specific to the intergenerational poverty group that passed in that big mass tax overhaul. But then that got taken away in the 2020 session. And there were a couple of bills that were proposing to focus again the state EITC on intergenerational poverty this last session, but it didn't go anywhere.
I'd just like to comment on that. As you know, we love to see movement towards establishing a state EITC, because it does increase that uptake and the likelihood of filing your taxes, and you're just getting more money if you have both of those EITCs. But the biggest drawback to what the measure that did pass was the fact that it was limited to those who are defined to be living in intergenerational poverty. And in case you're not familiar, that means that these families have drawn on state benefits. So you can be below the poverty level and never draw on state benefits, and you're not going to qualify for that credit because you aren't defined as living within intergenerational poverty. So yes, we want to see a state EITC established, but we want to see it broadened to be more relative to the federal poverty line and not based upon whether or not someone has drawn on state resources. I don't know if you want to talk about that at all, Greg, or if you have any thoughts on that, but from a public health perspective, that's kind of what we're seeing and feeling.
Yeah. Most states that have an EITC, it's just a percentage of your federal EITC. And there aren't a lot of credits on the state side like we've been talking about on the federal side. So if a state has 10%, that's still pretty healthy. That could still be $500 on the state side. We're just choosing to do it differently. So I'm sure there's other states that just don't feed off federal, but everyone I'm aware of, I think it's over half the states, just take 1% of the federal EITC.
Another question in the chat from Jennifer Garner. Are you already going through schools' Peachtree emails?
Yes, and I can answer to that. I did try to do that initially when the program started, but there was a large cost in order for us to be able to share that information. So we weren't successful in getting them through Peach Jar, but we are working with the Granite School District and their Educational Equity Department. So we are sending it to them, but not specifically through Peach Jar.
And then another question from Kara Bird in the chat. Are these materials distributed at food banks and food drives?
Yeah, thank you for asking that. So we do work with community health workers through the Eitc Scholars Program here at the University of Utah, and I know that they're all over the place. I haven't specifically heard of them going to the food banks or anything of that sort, but one of the biggest outreach purposes that they're doing right now is working at the health sites of the clinics that they're doing for the COVID vaccines. So I know they're sharing information there.
And I just sent the simple brochure. I guess the simplest one of all our brochures to you, Joey and Nathan, just here's the tax service. You know, whatever we can stuff in there. We used to have, oddly enough, great success out of the Redwood Food Bank, which still exists. But I know that somebody took them and made sure they went in every box. So yeah, if we can have a guarantee that they'll go into every box, and we'd love to send out brochures for it. They do respond, gets a response.
Elena Pierce has her hand up. Go ahead, Elena.
Yeah, thank you, Joey. I just wanted to say I work at a local health department in prevention work, so substance abuse prevention, injury prevention, and with our violence and injury program, we have been hearing about EITC, but quite honestly, I didn't fully understand it, and I didn't see how it connected with the work that I'm doing, trying to get kids in car seats and bike helmets and those kinds of things. Like, how is that going to improve our community's overall health and safety? But I get it now, and I appreciate this opportunity, and it helps me to think outside the box and to be thinking about our WIC department and our car seat technicians and all of those people that are interfacing with the community that would probably be benefit from all of these services. I finally get it. So I appreciate this opportunity and would welcome all of the materials to try to get out to our staff and hopefully do some social media promotion as well, so that we can assist with this effort. So thank you very much.
You're welcome.
Yeah, and I just wanted to thank you for that, Elena, because one of the things that we see as kind of a path forward is, you know, there are these local health departments, and we've identified some of them through Ouch. And, you know, if we could find places that we could partner up with local area student or, you know, AHEC scholars that might be in that area, it's a nice, you know, kind of partnership where there is this place where people are coming and interacting with folks, and then we could, you know, kind of supply maybe some volunteers to lead clients through the survey and connect them with the VITA tax help. One of the things that we are trying to do is to try to determine if we're making an impact. And so we kind of, you know, we definitely want to have partners, but we also want to make sure that we are able to kind of trace it back to where these referrals are coming from, what has been, because it's a really interesting question of like, what works and what doesn't, you know, and if you have, so we would love to be able to kind of modify our survey so that if, you know, if people interact with folks and your clinic, we know that they came from there, and that you know, that partnership is working because, you know, because we're thinking is trust, but then we want to kind of pinpoint like the sources of trust, so we can kind of go forward and say like, hey, state of Michigan, you could do something like this too. And it seems like these kind of opportunities work better than those opportunities. So we're trying to kind of keep track. And it's also, you know, one of the things that we're trying to do is to get us and everybody else, you know, some state appropriation funds to make this program ongoing and to maybe tuck it into a community organization. You know, this is kind of a demonstration program in some ways for us. We're trying to demonstrate that this works. So we're totally excited to have partners, and we want to be able to, though, just to make sure like, hey, that referral came from this place. So, you know, those will be some of our growing pains, but bring it on. That would be awesome.
That's the issue with public health there, Lori. We're going to connect you with all sorts of people that are going to make your evaluation more and more complicated.
Elena, thank you so much for your feedback. That is exactly what the purpose of this event was. This is true upstream primary violence and injury prevention. This is true primary public health approach. We are, by addressing the economic instabilities that families experience, we're reducing those stressors that contribute to situations that lead to adversity for children in early development. And so while the other efforts that we do are so important within public health and in the, you know, human services and child and family services, this is a way for us to empower families and give them the boost that they need to be able to reach the next level. And I will just give a quick personal anecdote. I am a divorced single mother. I am a single filing head of household, and I have benefited for several years from the earned income tax credit. And it has been a huge benefit to me. And I know that it would be to other families, but we need to encourage them to file. The reason why they're not getting the credit is because, well, we actually don't know all of the ins and outs of why people are not claiming the credit. But we believe, as Greg mentioned, that a huge piece of it is because people fall below the required filing line. And it's just something that's too stressful. Listening to Greg's presentation was stressful because of all of the ins and outs and the numbers and the information. And that's why the support from these amazing volunteers that help help people file their taxes is so important. It's really heroic work, and greatly appreciated from the public health perspective. Are there any final questions before we finish up?
I just wanted to make one comment. There's several questions in the chat, like, well, what about money management? And that's really important. And so we, as a group, one of our partners, our team members, is Ann House, who directs the Financial Wellness Center. And so that has been her drumbeat from the get-go. Like, well, what about, like, if we say, oh, you're going to save this much, you can put this much money into like a savings account. And so we totally see the value in the importance of financial management. My department offers a path towards, personal financial planner program. But we kind of had to start with what, start at the start. And so for us, starting at the start was just getting people to file and having that, that infusion of resources. But clearly, like, that is like the next step of, once you get them to file and to think about kind of how that can be important, and, well, how could you leverage, just a little bit of savings. So that's on our radar for sure.
And I'm seeing the comments on USU, which is a great resource. We have circles in a couple of the counties, and circles is nice because of the, when people drop out of these classes and you ask them why, how to get the kids dinner, got to do homework, got to get the babysitter, didn't show up. And circles is like, come on in, we'll feed you, we'll have a babysitter for you. We also have Fair Credit Foundation with their classes that we work with. We had a grant more than a couple of years ago, and we had folks talking to clients about what they're going to do with their refund, and the learnings from that were fairly incredible. We learned, first of all, that we got to make sure we're not speaking down to people, because we learned a lot of lessons when they told us how well they were budgeted. It would amaze you. These people know what they're doing because they have to live on such a small amount of income. And also take some of this money and treat yourself to something. But then, are you interested in these things? Most people are. You're saving for a car, you're saving for education. And a lot of people have this money spent. When they're getting this new child tax credit coming out monthly, is going to be a big change for clients, because they get all that in one lump sum, but they're paying off, and their landlord knows that they're paying off December, January, February, they're paying off the Christmas bill. And now we have insurance and car tires. I mean, some of this is they have it planned. They're very, very good, but yes, they're figuring it out on their own. So I appreciate the comments on USU and financial education in general. But these folks will be going through a change if this new child tax credit, is paid out monthly in the future.
Okay, if there aren't any final questions or comments, I'll give you just a second for anybody who might be hanging on to that last thing that nobody asked and they're just not sure if they should because they feel like maybe it's a dumb question. There are no dumb questions in this setting. So any final questions there?
If Joe, if I can say, if there's any specific tax questions, you go to taxhelputah.org and there's a contact on there. I'm on that email every day. So sometimes you get, hey, I got a personal question. Any questions about taxes, please just go through that and we'll get back to you.
I also want to give a plug for the evaluation, that's the survey that's going to be sent out. Lori asked that I put an option on there to get emails for people who are interested in connecting with Connect to Collect. So that's a good way to get connected with them, is making sure you complete the evaluation survey that gets sent out today. Thank you.
Nathan, sneaky. Got to get those evaluations. It's important to the grant that funds this work, but it's also important in allowing us to really refine and polish the content that we give you every quarter. And so please, 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 if you can take just a few minutes and fill out that evaluation, we would be so grateful. Huge thank you to Greg Mcdonald and Lori Kellowski Jones for this very informational and important presentation. As a reminder, there was a question in the chat again about the presentation. It is recorded. It will be sent out with the follow-up email where you will receive the evaluation form. If you want or require a certificate of completion, there will be a form for that as well. All of the resources that have been posted in the chat will include that as well. And then all of the printables and posters that have been developed by Connect to Collect, as well as the Utah Department of Health, will be included in that link. Also remember, if you are in the area of the Cannon Health Building and you want to pick up printed materials, we do have some there. Feel free to reach out to me or to Nathan Malin to schedule a time to come and pick those up. Thank you to all of our partners who made this event possible. And I hope that you are able to take this information and incorporate it in the work that you do. This is great info and it's enlightening to us, but it doesn't do anyone any good if we don't move that effort forward in the work that we're doing. And so thank you so much for your time, Greg and Lori and everyone who is here. And please have a wonderful remainder of your day.
Great, thank you.
Thanks so much.